Start, Priya.
Okay. Hi, good evening. May I speaking to Madam Mariam?
Yes, good
Uh,
evening, Mariam.
Hi. Yeah, you must be Mother of Jara. I'm Dr. Yang, one of the children doctor here. I'd like to talk to you about Jara today.
Yes, doctor, you are very welcome, no problem.
Okay. How are you today?
So quite okay, but I am very anxiously waiting here. So, what's going on with my child?
Yes, I'll try and get some information for you later, Madam Mariam. May I know what brought you here today?
Uh, we are in parties. We were celebrating Jahra's friend's birthday, and suddenly I was rushed to my child, and then I was hearing some sound and rushed to my child, and I see that she is horrible. She was horrible that time because her face was swollen. She was red, and some abdominal sound are coming. She was about to die.
Oh, must be very frightening situation. May I know which of the symptoms start first? Was it the rash?
So at first I see that that was rash, and then I see that she is losing consciousness, as well as some sound was coming also from the chest.
Okay. Can you tell me more about the rash? Where did it start? Which part of the body did it start from?
So it was red, and it was over the whole body, which was exposed.
Okay. How does it feel like? Is it raised? Could you feel it?
Yeah, it was raised, definitely.
Does it disappear if you press on it?
No, actually, I didn't do these things.
Okay. That's all
I
right.
was not in sense. Yeah.
Okay. Madam Farah, you mentioned that Jara had was unconscious. May I know more about it? Like we were trying to wake her up, but she doesn't respond. Was it like that?
So she was not that much responding, and she was gasping actually for the breath.
Okay.
Maybe not, she lost all of his consciousness.
Uh, I'm so sorry to hear that. It must be very frightening. Was there any bluish discoloration of the face or the lips?
Yes, doctors. Uh, Only I see that lip was bluish.
You also mentioned that the face was swollen. May I know which part of the face was swollen? The eye area, or was it the lips?
It was lips and as well as tongue also.
Sorry,
Lip and tongue.
tongue. Oh, okay. Um, how about the sound that you heard from the chest? How was the sound like? Was it a musical sound?
Yes, musical sound was coming.
Okay. Did you hear any hoarseness of voice?
No, no, no. Voice was not that much coming. No
No.
hoarseness.
Okay. Was there any noisy breathing?
No,
Okay. Did she have any vomiting or any diarrhea?
no, no, never. We
Okay.
were enjoying the party. She was completely okay.
Okay. May I know what did she have during the party? Was there any new food that was introduced to her?
We were eating that time.
Sorry, you were eating at
We
that
were
time.
at that time gossiping and eating.
Was there any new food item? Any food item that is new to her? Just only be introduced today?
Before that, cake was introduced, but I don't know this time. I don't know. We were eating cake actually, but
Okay.
she ate cake before.
Uh, okay. Did Zara had any allergy before this?
Yes, she is very allergy prone.
Allergy to what, may I know?
So she had allergy to cow's milk. She had allergy to um, uh, egg, and as well as she had very itchy rash all over the body.
She rash, was she being admitted for the allergy reaction before this?
So this allergy rash, actually, doctor said about it is eczema.
Eczema. Oh, I see. Has she been admitted before?
So yes, it was. I mean, it was diagnosed, and she was treated for this.
And when was that?
So it is since 1 year of age. I'm giving her I'm giving her emollients, steroid.
The eczema, yeah. Um, so has she been hospitalized before? Like, was any treatment given other than emollient for the skin?
No, never. It was, I mean, always treated outside the hospital.
Outside, okay, I see. Um, today, when Jara was having the food at the party, was there any is there any possibility that she was exposed to any cow milk product or any egg?
Um, I think now I'm certain, maybe I don't know, but cow
Okay.
milk is, she had this cow's milk allergy, cow, and also egg allergy, but it is not like this. I mean, it is not like this kinds of breathing problem, or
Mm,
it's happened like when I gave him, then some rash appear in the body, and I stop it, and it's become away, and sometimes some loose tummy. That's all, but never it's get these types of problem.
I see. I see. Must be very worrying. Madam Mariam, can I get a little more information? May I know, was Zara having any fever
No,
prior to today's event? Okay. And was she ever diagnosed with any, was she having any symptoms like itchiness over the eyes, usually on on a regular day?
no,
Any runny nose like early in the morning, frequent sneezing?
no,
Is anyone in the family having this kind of problem like asthma or itchiness over the eyes or the nose?
yes. So my husband is asthma and having this allergy as
Okay, and how about Jara? Does she have any asthma?
well. No, not asthma, but it was there. Some sound was there in the uh, it was I think it was 2 years old when having this sometimes having this sound, and with a cough and breathing problem. But that times doctor also only gave some inhaler, that
Mm,
is
mm.
Abdu inhaler, and it goes away when she was um, I mean 3 and 3.5, and then it's quite okay, and there is no more like this kinds of sound.
Okay,
She
all
was
right.
completely okay for 1.5 years.
I see. So may I know, just now, when the event happened, was Zara having any abnormal movement, like her limbs were moving or suddenly become stiffness, but or moving in an abnormal manner?
No,
Okay. Um, I'll ask a few more questions. Did Zara ever complain of having chest pain or any heart racing event?
no,
Okay. How about was she having any cough?
no, no,
No, okay. Any abdominal pain? Sorry, any tummy pain?
no.
Okay, her poo and pee were okay.
Yeah, okay.
All right. Zara, previously when you say she had some breath breathing, fast breathing episode when she was 1 year plus. What was the trigger to that?
So only any kinds like any fever and cough, then having this problem also appear.
How about other substance that she was exposed to, like
Okay. So it's
sorry.
like no, just dry. I have to always take care the skin should be smooth. That's all.
Oh, okay, all right. So has do you have any development concern about Zara?
Yes, all things are okay. I mean, she is now can walking around and doing everything, running, hopping, and
Okay,
as well as she is doing in the nursery excellent in terms of writing.
okay, that's very
And
good to
she,
hear.
yes, very friendly with her all the friends and playing.
Okay, she must be a very
Yeah, role
lovely
playing.
girl.
She can do role playing, and she can tell any songs, story she can make. She is super
Mm,
brilliant.
yeah, that's great. That's great. Madam Maria, may I know more about Zara's diet? She's allergic to cow's milk and also egg. So were you the one who will be checking the food label of all the items?
Uh, she having many allergy actually. So
Mm-hmm.
usually we are not taking any cow's milk and other things. We are in a family. We are not using nut anytime in our life because we do not like nut. Me, my husband, my kids also like.
Yeah, I
But
see.
I like.
May I know if Zara was born at the right time?
Yeah.
Okay, so was there any problem when you were pregnant with her? Any fever or rash? Was the jelly scan normal? Hello.
Everything was normal.
Okay, so during the delivery process, there was no issue as well, I think.
Yeah, no
Yeah,
problem. No issue at
okay,
all. No
I
hospitalization.
see.
Operation.
Has she has she received the vaccination as per protocol?
Yes.
Okay, so how can you tell me more about your family, Madam Mariam?
Yes, me and my husband and I have other three kids. So
Okay.
everyone is, I said you that having some history of some diseases, same type of problem. Um,
Okay.
yeah, that's all.
All right. And you and your husband are not blood related.
No.
Okay. So how about is there any disease running in the family except for the bronchial asthma in your husband?
Yes.
All right. Do you have any financial
I'm,
issue?
but what you want to know, especially anything? I mean, time is up.
Time is up. No, actually, so fast is up. Okay.
Okay. So, okay.
Uh,
So just give
uh,
a summary.
Summarize, I spoken to Madam Mariam, mother of 4-year-old Zara, with underlying allergy to cow's milk and egg, who presented with um, rash, generalized rash and swelling lips and tongue, along with wheezing episode, followed by episode of unconsciousness after exposure to a possible cake at the party. She has family history of bronchial asthma in the father. She's also had underlying eczema and history of preschool wheeze, which is most likely viral induced.
Okay, please
So
give your differential diagnosis.
my differential will be anaphylactic reaction with underlying secondary to possible cake with underlying allergy to multiple food allergy and eczema. Differential being I, immune thrombocytopenic purpura or malignancy.
Okay. So, malignancy, ITP. What other could be?
Sorry?
So, your differential diagnosis was very inappropriate. You can say that it's true. Actually, it's my I think this is my primary diagnosis. So remain stop there and then ask for the differential diagnosis. So you can take the differential diagnosis for each and everything separately, because you can't say ITP only. If you say out ITP, then you have to give some points against it. Actually, malignancy will not come with this acute presentation. But I mean, if you say something, at least you are not happy with this differential diagnosis, right?
Yeah.
So in that case, you have to say, you will not say spontaneously in the exam if you are not happy. If you have any confusion with anything, so you should not invite this. Am I right? So you remain stop. And then if they ask you, you can say these things, and then that against point, because ITP having many things to be, you can say. So I can say why it is not ITP. Can you please tell me?
Because the rash is palpable and there's no other bleeding tendency that the mom mentioned.
Yeah.
Then another differential could be viral examptum, but the child did not have any fever and she was perfectly well prior to the incident.
So
Is that better?
what could be the foreign body?
Yeah, it could be a foreign body.
So it could be foreign body, one of the things.
Mm.
And can it be acute exacerbation of bronchial asthma, because child was diagnosed with some acute bronchial asthma, right? But against point is rash and sweat. Yes,
Yeah.
you can stop here. Not required to give a lot of differential diagnosis. Okay, so tell me that if you are in the hospital, it is an acute presentation. So you are in the emergency room, you are as a doctor. So it came also, in the video station, same way. So we have to learn it by this way. So as a doctor, how you started to manage an anaphylaxis child? What is your first step?
So I take a complete history from the mother, then followed by a general examination. So I look for, I will check the vital signs, the BP, heart rate, the SpO2, and temperature. Then I will assess the airway, breathing, circulation of the child, and if required, I need to secure the airway. If there's any obstruction, I could give adrenaline, IM adrenaline. And then if there's any ongoing wheezing, if required, I could give IV hydrocortisone and or salbutamol. Then if circulation is perfusion is compromised, I could run normal saline bolus. Then to look for any if not resolved, then I need to repeat another dose of IM adrenaline.
Okay, so you will, if it is not improved, then you will start IM adrenaline 2 times.
Yeah, I repeat after 5 minutes.
So what you are in, if you are thinking that you are in the hospital, then what you will do? It is, you are in the hospital.
If there's any compromise in the airway, then I might need to intubate the child to secure airway.
Yeah, I agree with this, but I am.
Sorry.
But I'm asking, I am adrenaline. If you are in the hospital, then you are giving I am adrenaline. one dose. I mean, I understand, but you have scope of giving anything more?
IV hydrocortisone and IV ranitidine.
An adrenaline IV you can give.
Okay.
Okay. So you get the patient having some stridor was there, and
Okay.
you give adrenaline, and when you can repeat it, like you gave it, but immediately after, or at how many time interval you can repeat it?
5 minutes?
Yeah, why not? Okay. So after then, it's some wheeze also coming out.
Some wheeze. Then I'll give the for the wheeze, then I give IV hydrocortisone, then I give some net salbutamol, and if it's ongoing, I might need to start IVI, I mean the infusion salbutamol, and even aminophylline.
Yes. So somehow the child was in shock.
Okay, then I need to run
So
fluid
gave
bolus.
adrenaline. I mean 2 times adrenaline already given.
I can net adrenaline as well. Net adrenaline, then infusion continuous infusion IV adrenaline.
Adrenaline IV infusion. Yes.
Uh,
Actually, whenever the child is in shock, then hydrocortisone and other things was not mentioned. Only mentioned, you should mention repeat adrenaline IM and adrenaline IV. Okay, NEP is not important that time.
Okay.
I
IV
understand
and
that your child, you treat this child and you manage this child, but remember that dose is also you should know. Okay, your child is 4 years, so which how much adrenaline IM will be required? The question will be like this, and please in the video station.
It's 1 in 1,000, 0.3 mils per kg.
So up to 5 years, 150 microgram. But if you can remember 1 into 1,000, 0.155, 0.15 ml. Okay, so I understand that anaphylaxis we did. Then we manage this child. Child is improved. Then what could be the subsequent management?
Next, we need to education to the patient and the family to avoid possible allergen, and to check the food label each and every time the child is every time they are introducing new food item to the child. Then the child should also be prescribed an EpiPen and taught on how to use it. Taught on the family members or main caretaker how to use it. Prescribed tool that they should be keeping at home or wherever the child go. The child should also have a medic bracelet, alert bracelet.
Okay, so you are giving all the advice. So you are going to discharge her?
Need to monitor the child for at least 6 hours, and best if it's 24 hours after the event.
So the child having you discharge this child after 24 hours. So you discharge this. You are going to discharge this child after 24 hours.
24 hours. One day, 24 hours. Hello?
Yeah. So if it is like if mom said no, I am now not want to going to hospital. No, I'm not going to remain here because my child is completely okay. So what do you think?
I'll tell her there's a possibility of a biphasic reaction that could happen about after a few hours after the initial event.
So at least 6 hours you keep the child, right? And then you admit discharge and with the advice that biphasic reaction.
6 hours,
But
okay.
in some case, you can't even discharge after 6 hours, right? Especially when, in which case?
Like in this child where the airway is compromised and and
Okay, so but it is written that if they have severe asthma, history of severe asthma that require hospitalization, or if you could not understand why this anaphylaxis happened, then you have to keep him in the hospital. Also, biphasic reaction if they are, or so at least three things you should say. Okay, so you give all the advice. I understand that how it is happening and what EpiPen related questions will be there. I mean, you explain it. But how you have to, I mean, where you have to refer or what you want to do for the in terms of referral. This child require any follow-up or referral?
Yes, the child will need a skin prick test to identify the allergen that she has. I mean the substance that she's allergic to. So should be follow up under immunologist. Actually, we don't have it here. So I'm not sure what's the specialty.
Okay, you know, immunologist
Is
is
it
when
immunology?
immunodeficiency. Yeah, they have allergy specialist,
Allergy
or it
specialist.
is
All
written
right.
like specialized allergy department. Okay, so you have to
Allergy
give
specialist.
this.
Okay.
Not only this, you have to give a patient leaflet to understand and add with the support group. You have to give this information to the their school or nursery, and nursery nurse should be informed. Okay, and you have to give oral antihistamine and steroid for 3 days during discharge. And also this child is how many in auto injector have to given or EpiPen have to be given. Okay, don't forget the bracelet. This child require bracelet. Okay, steroid. Whenever we give steroid high dose, we give bracelet. Also here we will give bracelet. Okay.
Then the bracelet is given for the steroid, even though it was only given for 3 days. We are afraid of the
Bracelet is
withdrawal, is it?
only, yes. So
Allergy
bracelet,
bracelet.
yes, allergy bracelet or any kinds of bracelet. So those who are having any risk of sudden like loss of consciousness or sudden severe reaction. So if give bracelet, then it will in the bracelet it will be, I mean, it will be documented, and the hospital immediately can understand. Anyone can take this child to the hospital, and hospital understand where is the problem, what is the problem. So I will share with you that in which disease we have to give bracelet. Among them, very important is, for example, congenital adrenal hyperplasia on medication. And these, those who have recurrent severe asthmatic reaction, so they are getting high dose steroid. And then also this one, even WPW syndrome, those who have SVT require this bracelet. Okay. So usually skin peak allergy test, if it is not already done, then you have to understand why it is happened. But whenever you have confusion that what things happen, which can do this problem, then you have to go for muscle chip test. Okay, so you answer all the question. That is the discussion, but was very excellent. You know the IM adrenaline and other things, but in the management, I just want to hear that child, you have to remove the allergen. So the child having cake, okay, in corner of the mouth. So it will be continuously provoked. So you have to remove the allergen. And you have to, whenever you say that I will take history examination, when it is a case which require immediate intervention or emergency department, then you should say, then I will take rapid focus history and examination. I will ask for help like this. You get my point? Just
Yes.
30 seconds or 10 seconds. I will take rapid history and examination. What examination you will do, it's not necessary to mention because you are in a hurry. You are in emergency room. The child is going to be dead. So what you will do, you will take rapid history and examination, call for help, and remove allergen. And I will start with the oxygen. Child breathing problem, oxygen, right? But you didn't give oxygen, what I understand. Then you will give adrenaline IM and you will repeat it, and you will see that how they are airway breathing circulation. After giving you, adrenaline IM is such a things. We will discuss in the communication chapters. Must we have to do this? That how we will give the adrenaline IM and other things. So outer part of the thigh, over the dress even, you have to just give it. So it is very important and life-saving. So you have to give it, and then you will also assess the side-by-side the airway breathing circulation and other things, and you will repeat it, give adrenaline nebulization, hydrocortisone for the stridor, but if it is breeze, then I will continue to give, along with this measurement, I will give the salbutamol IV and aminophylline as well. And if the child is in shock, then I will give the shock management, that is normal saline bolus along with adrenaline IV. Okay. So it is mentioned in the guideline that crystalloid, that is normal saline 0.9%. So you see that I said everything, but within very few minutes, I said everything, nothing remaining. So after then, if it is as apnea, then why will we bag mask ventilation? If the child having no pulse, there's no breathing, child silent, then I will go for the basic life support. And other things already I mentioned, but it's usually we've missed it. That is the allergy specialist, very important. And time to time follow-up and require and to give the lesson, how to use it, what is happened, and other things is very important. 2 adrenaline pain auto-injector always should be, okay, 2 adrenaline pain auto-injector always in the home and also in the school. Child will carry 2 adrenaline auto-injector. So usually child with the parents. So in that time, parent also carry 2 adrenaline auto-injector if they go outside. Even this kinds of child is having these things. So when they wants to visit any country, before that they have to take the leaflet and other documents, extra adrenaline auto-injector, that they are going to visit it. So in that time, how they will do, even in the aircraft, what you will do if it is happening. So many things is there. So here important things that you missed in your history, that your history taking was amazing because you ask everything. It was an emergency, so you can you have to know everything, but just you missed that when I said that a piece of cake, so you can ask, you know what is the component of the cake. Okay. So I mean, you ask it, maybe in the real exam they will say everything, they will be open up more than me. So but it's like and then I will say maybe in the nut also, usually not having these kinds of allergy, the severe allergy. So nut is, she was not taking nut anytime. Their family tradition, she was not taking nut, but she had allergy. So any test done so far, any, so you ask something like this, yeah. So that was missed. And what are other things very important for all, Dr. Gauri and Afsan also, whenever it was an emergency case, the settings is emergency room, outside the emergency department, in that time we should not ask how are you. Okay. So because mom is now not happy to answer you, how are you? It may be rude for some parent. And even you should not say nice to meet you. You should jump for the scenario. For example, I can understand you are very much worried. You are eagerly waiting, so I'm just wants to know what happened before the. Can you please tell me what's happened so that I can help you more like this? You understand that's a very serious situation. Another thing is, yeah, I just write it. And a rash related question, if you ask, then please ask, is it itchy or not? Because it can identify also. But you understand this child having anaphylaxis because many points was there. Okay, and how rapidly this reaction happened, it's also important. I mean, after taking the, it's important with the prognosis even. So it's I mean outside the house, after taking the cake, when it is happened, if it is happened previously, same or not. Okay, you can ask it. Yes. So guideline is important, and I'm just want to show you something. um, it's came previously many times, and so you see that better to ask at least 18 questions. But sometimes this scenario is different. Like known case, diagnosed case, sometimes it is not like this. So party 8K, sudden onset breath swelling lip, went to the hospital, improved in the second day, known case of asthma, positive family history of allergy. Ask about DD management, details of cake component, important. Okay, it's written. It was not written by me. Someone was written. Oh, here important things, the child how came in the hospital. So it's, I mean, any emergency. Emergency history was also SBT history. So how the child came, or hypoglycemia history. Just the child was brought into the in the ambulance. So that time, what was given? Any measurement was taken? Yes, that time adrenaline iron injection. One injection was given. Then the case will be more clear. And then he was better. The sound was goes away. And then it's happened, like, if you say them 999, call 999, then they understand that could be allergy, and they will say give allergy, give iron adrenaline. Even if it is not very clear cut, they say that better to give, not to mist. Okay, it's life saving, very important. I have some relatives came from the UK, and they have some problem. I don't know why they have so much allergy. In our country, it was not like this, not too much allergy. So then she also, I mean, her mom is so clever and so much serious about it. Each and every food component, she asked what was made by this, and then she tested, then only then she gave it. Because you one time see that your child is going to die by eating these things, then you will be very much conscious. It's happened like this. And another was ST4 clinic, raised itchy rash. Had this a year ago, raised itchy red, white center, happened after Christmas, allergic urticaria and something more there. Skin patch, skin prick test were discuss about other diagnostic tests, forget about skin patch, skin prick test, were discussed RAS testing. Okay, so what about the RAS testing? So it is like, if it is happen like so like idiopathic anaphylaxis, that you have to do these things. Okay, and it is not very much nowadays, it is not common, or it's not must, but It is called muscle chip test. Okay. So here you have to do this immediately after reaction, 1 to 2 hours after symptoms, and more than 24 hours after symptoms. Okay, this is the things. Okay, I think it's enough.